Good afternoon. I am Ann Mazikowski and on behalf of the League of Women Voters of Central Delaware County and our program co-sponsor, the NAACP Media Branch, I welcome and thank you for joining us today for an expert-led panel on post-incarceration reentry, problems, policies, programs, opportunities. Many thanks to our Civic Education Committee members for organizing this program today. We are especially grateful for the help of Kathy Youngman for her technology support and expertise recording this program. The League of Women Voters, a nonpartisan civic organization, encourages informed and active participation in citizenship, elections, and democracy, and works to increase understanding about major public policy issues through education and advocacy. Civic education is and always has been a priority for the League. Over the past years, we have partnered with the NAACP Media Branch to sponsor a series of presentations focused on the criminal justice system. Today's program on post-incarceration, reentry, problem, policy, programs, opportunities is a panel presentation of experts moderated by Maurice Q. Jones of PA Recycle Works. As part of the registration process, we received many of your excellent questions, and these questions were shared with Maurice. Please utilize the Zoom chat function to ask any additional questions during the discussion. The questions will be monitored by Civic Education Committee Chair, Ralph Graves. We are recording this event, and a link to the recording and other shared resources will be sent to those that registered. The recorded program will also be available on our website, LWV-CDC.org. At this time, I'd like to introduce Maurice. He is an advocate for reentry equality. He founded and runs PA Recycle Works. The mission of PA, which stands for People Advancing Reintegration, and then Recycle Works, is to reintroduce recidivism through electronics recycling by employing, supporting, and hiring those formerly incarcerated. Maurice was a panel member of a previous civic education program and suggested to the committee the topic of reentry. At this time, Maurice will introduce our panel.
Good afternoon, everyone. I hope everyone can hear me. I try to speak clearly, but not too loudly because I can't speak loudly. I want to start by sharing some ground rules. I think when we are opening up, we're sharing with respect. We're coming to this with openness. You have a right to pass if you don't want to speak. You absolutely can speak, because this is a workshop for us together. And I would say claim opinions and don't speak for others. And if there are any others that one can think of, I would absolutely say drop them in the chat. I want everyone to take 10 seconds and clear your mind. 10 seconds and clear your mind. And as you're clearing your mind, think of the worst thing you've ever done. Worst thing you've ever done, whether you've hurt someone's feelings, you said something that you shouldn't have, or you've done something in some shape or form. Hold that in your mind. And think about being acknowledged, called by, referenced to as that. Not only as that, but as that going for employment, going for housing and resources, even in some instances not being able to take advantage of some of the resources that are readily available to others. Hold that in your mind. And that's some feelings that thought brings, whether it's guilt, whether it's sadness, whether it's a heavy weight. These are some feelings that individuals are facing when they're coming home from prison. and what we call reentry. I want to introduce Rob Reed. He's been a career public servant for the last 38 years in the federal and state governments. He served as an assistant U.S. attorney with the U.S. Attorney's Office in D.C. and more recently in the Eastern District of Pennsylvania. As a federal prosecutor, Rob investigated and prosecuted a wide range of cases. Beginning in 2002, Rob held a number of supervisory roles, including Chief of Firearms Section, the Anti-Gang Coordinator, and the Violent Crime Coordinator. In 2010, Rob was named the Executive Assistant U.S. Attorney. In the latter role, Rob was responsible for expanding the office's vision of criminal justice from solely relying on prosecution to include violence prevention, prisoner reentry, and community outreach, including working with underserved communities. Rob was instrumental in supporting the trauma-informed care training of criminal justice professionals within the Philadelphia Police Department in the EDPA and the DOJ. Rob has also helped expand the USAO's nationally recognized prisoner reentry program. In March 2017, Rob was appointed as Executive Deputy Attorney General in the Pennsylvania Attorney General's Office and now oversees the Special Initiatives section. He speaks across the Commonwealth on a number of issues, including the opioid epidemic, gun violence, campus safety, prisoner reentry, civil rights, and trauma. In 2017, he spearheaded the creation of the Pennsylvania Reentry Council, which he chairs, that for the first time brings together reentry stakeholders around the Commonwealth. Beginning in 2017, Rob also initiated an effort to make Pennsylvania a trauma-informed state. In 2020, Rob was set to work with Governor Tom Wolf's Office of Advocacy and Reform to create a trauma-informed Pennsylvania, and now oversees the Criminal Justice Action Team to enhance criminal justice outcomes. Welcome, Rob. You've done amazing work across the state and for our country. I really appreciate that. I want to introduce Jamila Harris. She's a certified recovery and forensics peer specialist with supervisory and management certification endorsed by the Pennsylvania Certification Board. She is a woman who was impacted by the criminal justice system and has dedicated her time to helping other women who have also been impacted by the criminal justice system. As an advocate, provide trauma responsive care and transition back into the therapeutic community as a productive and empowered returning citizen. She's done a lot here in our city, including working with the People's Paper Co-op. She's piloted a women's reentry program with the Mural Arts, and it's one of the first workforce development reentry programs for returning women in Philadelphia. Jamila has also interned and is still contributing member of the Incarcerated Women's Working Group, where she collaborates with ACLU, CLS, and other reentry organizations in Philadelphia to advocate and support the successful reentry of returning women. Jamila spends her time volunteering as recovery outreach coordinator for the Pennsylvania recovery organization Achieving Community Together, PROACT, and is a published author of fiction and nonfiction literature. Her goal is to support returning women and overcoming challenges in pre-entry, incarceration, and reentry. Welcome, Jamila. Lastly, not leastly, John Pierre Bryce, a resident of Chester, owns and operates an internet radio station, cmprradionet.net, located in Upland. He also works for Chester Partnership for Safe Neighborhoods as a resource manager. Cultivating mature positivity through constantly making progress is how he brought his radio station to fruition. His dream of having a real radio station in the city of Chester is still a vision that he is willing to walk. So as you have heard, so many people do what they need to do to survive. Not many people do what they have to do to live. Therapy unlocked that door for John Pierre, and as a resource manager, he pushes therapy to everyone he meets. Therapy saved his life and allowed him the ability to dream and follow it no matter what. Welcome. So I want to open it up to Rob to say, what made you start the Reentry Council? What was lacking in order to start the Pennsylvania Reentry Council and for you to actually get other people on board to join you there?
Well, if you have 30 years, I think I can answer that question. But let me say, and thank you very much for inviting me to speak here. I have actually been involved in the criminal justice system for 40 years, not 30, despite the fact that I look like such a kid. But I will tell you that in that time, I have seen a lot of tragedy, a lot of trauma, a lot of victimization on all sides. And so, and one thing that I really probably didn't get sufficiently, and I know I didn't get sufficiently, was the impact of trauma that was impacting people in the criminal justice system. And even though so many people in our country have been exposed to trauma and ultimately victimized, so we started in the federal system a program in 2006. It was the first time we brought together law enforcement prevention and reentry in a program to reduce gang activity in what's called the 222 corridor from Easton to Harrisburg. And I oversaw that. It was a really eye-opening experience. And then in 2007, we started something called a Federal Reentry Court, which has been a model for the nation. Two judges in the Eastern District of Pennsylvania have run this court since 2007 and 2009, respectively, and it's changed lives, and it helped everybody who was working in the court, as well as the people, the reentrants who are coming home, appreciate their own humanness. I call it rehumanization. And the support and the wraparound services that were provided and the love really that was given to the men and women in that program has been extraordinary. And that was a great model. And then in 2010, when I really started learning about trauma and the impact of trauma, and then I started meeting people in a different way who had returned from prison, including one person named El Sawyer, who's now a very close friend, who used the word armored up to talk about how he deals with all of the issues in society. And so the bottom line is that he was speaking about trauma. And then we talked about, we created a film, he created the film, which we funded, the Department of Justice, called Pull of Gravity. And it talked about the challenges of reentry, the overwhelming challenges of reentry. So when I came to the Attorney General's office in 2017, the first thing I said to the Josh Shapiro was, we need to create the Pennsylvania Reentry Council. And the reason I said that was there was something called the Federal Reentry Council, but I thought it was a model for us to bring to Pennsylvania, to bring together everyone who cares about this area, to really share best practices and then provide what are the barriers that are preventing people from achieving what they need to achieve to be whole and to recover from, whether it's mental illness or trauma, or to get housing or employment or whatever other benefits they need to do well and succeed in society. So we did that, and the reason for that is because, as I say, first of all, it's the right thing to do. And Mr. President Mandela spoke about why it's important for people in our society to, or in all societies really, to, judge all of its people, including its lowest or the perceived lowest, the same way as it treats everybody. And I would say that includes not just people who have been incarcerated, but people who have come home. And so we need to give people opportunity, and we need to make sure they're treated fairly and equally. So I think that's what we're trying to do in the Reentry Council. So I don't know, again, that's my shortest possible answer.
I appreciate that, Rob. I have a question just for everyone out there thinking about like language and how we like address people that are coming home, because that's like a elephant in a lot of rooms. People say prisoner, people say ex-con, people say inmate, people say, in Philadelphia, Mayor Nutter in '98 made a declaration to call people returning citizens versus, just person first language. So throwing it out there, Rob, how can we in Pennsylvania possibly, in thinking about trauma-informed care, use person first language, even with individuals that have been justice affected?
Well, as Joan Duval Flynn knows, we are both joint members of HEAL PA, which is an effort to create a trauma-informed Pennsylvania. I have some great news to report, actually, on this, and it involves the criminal justice world. And I got to tell you, I find it thrilling that change is happening despite the insanity of our lives, despite COVID, despite January 6th, besides all of that, there is really good stuff happening. After George Floyd was murdered last year, the Attorney General's office came together and we were talking about criminal justice reform. Make a long story short, one of the things that I recommended was that all police officers should receive training in trauma and trauma-informed care. And I also made the same recommendation through HEAL PA and folks in the governor's office. However it happened, the legislature passed a law saying that all officers need to be trauma-informed. And I've been privileged to work on the curriculum for all officers. It's going to be rolled out in 2022. So think about it. All police are going to learn about what trauma is and trauma-informed care, with the idea of creating trauma-informed policing. And I will say that I've been working on this for over a decade, and to me that's thrilling. The other thing is, and maybe closer to this conversation, although that is certainly close to it, I met last week with the new acting secretary of the Department of Corrections, George Little, who's replacing John Wetzel. And he's great. I mean, I just got to tell you, he's great. And despite, talking about how he totally supports the Reentry Council, he said one of his focuses during his tenure is going to be on creating a trauma-informed Department of Corrections. Let me say that again, creating a trauma-informed Department of Corrections and focusing on diversity and equity throughout the system. So those are two things, of course, that we are trying to do through the Reentry Council. But I have also been privileged and asked to participate in a review of a report that I have here, which is the Department of Corrections Trauma-Informed Strategic Plan. So think about it. The Department of Corrections that it houses thousands and thousands of people from Pennsylvania is going to be teaching people about trauma-informed care, and ultimately including trauma-informed services. I mean, it is a massive sea change. And yesterday I met with the chiefs of County Adult Probation and Parole in Harris in Penn State and talked to them about HEAL PA and our trauma-informed efforts and our efforts to make a trauma-informed probation and parole system and reentry system. So the bottom line is that change is happening. It's not going to happen, it is happening. We just need to keep at it. And there's a lot of champions now within these various areas, and champions who get it about trauma, who understand that many people, I would say everybody, this is Rob Reed's, don't cite me for anything, but I would say everybody who's been in the criminal justice system and especially gone to jail and is reentering has been exposed to trauma and maybe high levels of trauma, and there's a high percentage who have experienced PTSD. So we need to come up with much better programs to help all of those people heal and recover.
So Jean-Pierre and Jamila, I'd like to ask you guys, what do you think about like the city, I mean the state trying to be trauma informed, and how does that affect you guys' work? Because you guys are both in those fields. So Jean-Pierre or Jamila, I'll ask either one of you guys to jump in here.
I give it to the lady to go first.
Thank you. Good afternoon, everyone. And first, I want to thank Attorney General Robert Reed for the work that you are doing and the consideration that you're giving to trauma prevention care for those that have been impacted by the criminal justice system. It's needed, and I'm so pleased to hear that y'all acknowledge it and that y'all have plans and starting to implement that in the reentry system or in the criminal justice system in total. So thank you. With that being said, I want to make sure, because this is a very important conversation, that I answer this question specifically. So can you repeat the question again?
So I asked the question, like, how is the state becoming more in trauma informed? How would that affect the work that you guys do, especially you with returning women that are returning from incarceration and in therapy, which is both where you and John.
Yes, thank you. It would affect us in a way, most importantly, that I believe is by empowering the women that are impacted by the criminal justice system, because we have been traumatized by the experience of incarceration, and a lot of times by experiences in our life that led to our incarceration. So therefore, returning home and everyone that you're dealing with is treating you in a manner that's conscientious to your triggers and conscientious to what can set you back and conscientious to your existence. If we treat each other with care and with words that are empowering, non-stigmatizing language, it empowers us, it brings that energy to us, and it allows us to be proactive and rebuilding our lives.
Jean-Pierre?
I think it's very important for the state or for anyone with power to understand that the people that are committing these crimes are traumatized, right? From their core, right? Mom and dad not around, on up to different traumas that happen in life, because there are traumas everywhere. So for the state to be involved and the state to care shows the people that are committing these crimes that somebody cares, right? If you're giving therapeutic help when they're incarcerated, I was a part of therapeutic community while I did my time, right? And that helped me to understand the things that I was doing on the street that caused me to get locked up, right? So when I went home, I was an addict when I was on the street. I was getting high. I was running around. I didn't go home to get high anymore. I knew that I couldn't do that anymore. But the one thing about an addict is you'll find something else to be addicted to, right? So if you don't put good things in your way, then the bad things will continue to grow up. So, I had to go through that. I had to understand that. And I think it's key that the people that are holding the returning citizens before they come home, the prisoners, understand that they have to give them rehabilitation. They have to give them services while they're locked up. Without those services, they're just going to turn right around in that wheel and come right back in there again.
Jean-Pierre, I have a question for you. How
Yes.
large was your reentry office in your prison that you were at?
There was no reentry office in my prison.
Look, I like to hear that. Jamila, I have a good question for you too. How large was your reentry office when you were incarcerated?
There wasn't any reentry office.
Right. So like these are the challenges when we're talking about these perfunctory things or these intangible things of reentry, right? Is people being set up for success. Because that's what we're talking about when we're talking about like trauma informed. It's like thinking of yourself in being in that position and talking to yourself as if you're in that position, because that's a way to bring yourself out, right? So if there's no offices of reentry in the prisons where people are being held and are serving their time, how can one be successful? How can one be successful if it isn't intuitive? If they aren't able to be or aren't able to take part in TC, because TC is a way for cognitive behavior to be changed. This is an opportunity. So if one isn't privileged enough or make a case enough to go to TC or are intuitive enough to know that they need to change their behavior, how will they change their behavior?
They won't.
Bingo. So this is what I've learned about mass incarceration. So normally I don't self-identify, but this is something that's near and dear to me. I'm going to self-identify as someone that has come home from prison in 2011, February 2011. When I came home, I had to work four full-time jobs. 4. I had one daughter and I was taking care of myself. 4 full-time jobs. When I was in the halfway house, they wouldn't let me have more than one job. They wouldn't let me have a job and go to school. So this was my challenge in saying, hey, there's something blocking me here, and it's a system that's been set up that are blocking my successful reentry. I don't believe I successfully re-entered until, I cannot identify. Until that's the case where I can say, hey, reentry, I'm actually out of a job. If that's the case, reentry no longer exists, because now the function that I play when people are coming home from prison is to employ them, to be trauma informed as dealing with their challenges, and then to shape them up and help them in a system to find substantial employment, because we're a transitional employer. So if people aren't being set up to succeed, what are the functions of prison? If that time that's there is not set up for individuals to succeed. So there are four things that I know about prisons conclusively by advocates and prison folk that say prisons are for 4 reasons: retribution, deterrence, incapacitation, and rehabilitation. These are the 4, official reasons why they exist. I'm not going to disagree or agree. I'm going to say that's the 4 reasons that they say. However, I have a difference of opinion. Difference of opinion is that mass incarceration is a weapon of mass destruction that has been used against a Black and brown community right in front of us. It's tearing down families. It's tearing apart families for generations, setting people back for generations. Monies are divested from our communities because the monies are put in the areas where people are housed, not where they stay. We're trying to change that. It's called prison gerrymandering. We're trying to change that right now at present time, but this is the case. This is how it's been since the last consensus, and the last consensus before that, and the last consensus before that, right? So there are towns that are profiting from the monies that should be going into our areas where the people were residences beforehand. So this is a challenge. So people aren't set up to succeed. The monies have been divested from their communities for them to succeed. How can one succeed? Or what I know about change is hard. That's what I know. Change is hard. Speaking person first, change is hard. To do the same old thing is simple. If I know that I can eat, if I know that I can eat, if I go do such and such and such and such, it may not be above the law, or it may be. I know that I'm going to eat tonight, and I may or may not get caught. I know my family is going to eat tonight, and I may not get caught. A lot of things we learn by osmosis, like getting up and going to work, going to school. These are things that we learn by osmosis, but what if those things aren't learned? Where is that supposed to come from? How is that supposed to be learned? This is the challenges. These are the challenges we talk about when we speak about and we have conversations around reentry. Because it's all focused on day 1 preparation. When one is sentenced, before one is sentenced, before one commits a crime, there should be a talk about this system that is. It's not talked about. Now we're going to try to take it away out of the schools completely, not talk about the histories of it, critical race theory anymore. Because if we talk about how incarceration started, and where it began, and the police force that started it. Now we got to talk about something nobody wants to talk about, which is slavery. Nobody wants to talk about it. These are wounds that we've covered up with Band-Aids. Can anybody tell me what happens when we don't address a wound? I'll tell you, it gets infected. This is just an infection that's here, right? These are infections that are in our society and in our systems, right? We got to change it. I really appreciate what's happening in our state. I really appreciate what's happening in our state. I hope we can be a model state across, our nation, in being trauma informed across our whole state and in all the agencies that we have. Which of the state prisons have rehabilitation programs? They all do. They have programming. there are programming, but there's limited spaces for these programs. So you can be in the sew room making shoes, or learning these skill sets. Washing dishes is a skill set. Cooking food is a skill set. But if there aren't certifications for those skill sets when people come out, and or being placed in those jobs and having that job training, how can we expect people to do that when they come home? Jean-Pierre or Jamila, what has helped you in your successful reentry, or as you reenter? What has been some of the things that helped you to find your way, as you will? Because I don't believe that we're anomalies. I do believe there are many successful people that are reentering. I do also believe that there are many adjudicated people, or people that have been justice affected, that we may not even know about. We just, people get a stigma of Black and brown folk that we have to supersede. I got to be better than everybody else, and I know that. And I got to be extraordinary in order to be on a level playing field. This is something that I know, and it's okay because I know it, and I'm able to maneuver it. But because I know it, and somebody else knows it, that doesn't mean that they're readily able to maneuver it. So Jean-Pierre or Jamila, I throw it to you guys. What has helped you to have a successful reentry?
For me, it was empathy. It was understanding that I wouldn't be the last one to come from Dallas State Correctional Institution. I wasn't raised to run the streets, right? My father was a sales rep for Philip Morris. My uncle was an attorney for Delaware County in Chester, Pennsylvania. So I was raised around good people. I chose to run the streets to help my friends, right? My friends had less than I did. So I think when I came home, it was just at that time, it was time to stop, right? I couldn't leave my son, right? My son to walk in my shoes or my footsteps, the steps that I was leading him to walk in as a man. I had to change, and I had to shift what I was doing. So it was just seeing that and understanding that, I and knowing that I had to change. Like that was it for me. It was no one there to help me when I came home. My cousin had passed away, my grandma passed away, so I didn't have those people to talk to. And I said, all right, I have to find this myself. And that's led to me doing other things. But for me, it was strictly, just me, right? Just moving in a different pace, at a different pace, and not wanting to go back to jail. Like when I went through there, it was the worst treatment I've ever had in my life. Like, who are you talking to me? Why are you being weird to me? What did I do to you? Like, you're an officer and I'm just an inmate. I'm here to serve my time. Why are you being mean to me? So to me, I said, I'm not going back in there. I'm going to make sure I'm home and I stay home. So that was all it took for me.
Thank you for that, Jamila.
Yes, thank you. Like you mentioned, thinking for a change. The first, everything is internal. So having cognitive restructuring and thinking more optimistically or more realistically and not so hopelessly, which allows you to take a look at yourself, the changes that you need to make, getting the therapy that you need first and foremost to deal with the type of thinking that might have led to the deed and behavior, and then getting connected to peer-based programs and groups that empower you and give you employment. That helped me tremendously, because once I got connected to like the Department of Behavioral Health, has a certified peer specialist group, mental health partnerships, have a peer specialist group, BH10 has a peer specialist group, they employ you. So now you're dealing with your mental health disorder, if it is starting with you first, and they have peers that are willing to hire you and put you in positions of empowerment, where now not only are you working on yourself, you're out there and helping others. Now, not only are you helping others, you have a career. Not only do you have a career, now you can buy a house, you can get a car, you can live. You have to have those opportunities, because when we get out of jail, we can't get hired. We have a record. So therefore, it's very hard to get, and thank you for your fair chance hiring. I wanted to say thank you so much for being one of those employers that give returning citizens an opportunity to have an income, because it's so needed. And then having those peer programs, having recovery specialists, those who have experience of addiction, creating training and certification and recovery specialist peers, and putting them in intensive outpatients and giving them employment. And then having forensic peers that allow us to go to the court systems and advocate for those that are in the court system, that allows us to build reentry workforce programs, that allows us to sit on these panels. These opportunities, like the attorney was saying, creating, well, let's make a career for people who've had this experience, and let's bring their knowledge to the table. It empowers us, gives us something positive to do moving forward. And it also allows us to take a look at ourselves and, like you said, change our thinking.
Either Jamila, Rob, or Jean-Pierre, in your experience, how can we collectively, what collectively can we do to make it a better environment for individuals that are coming home? Like, how can we collectively do that in totality? I know, Rob, you mentioned Heal PA, and I believe that's one way, but, you know, can you give us some other ways?
Yeah, well, so let's talk about the Reentry Council. So the whole reason for being for the Reentry Council is to help people returning. So one of the things we've done is we've reached out across the state. There are now 34 county reentry coalitions, which, including Delaware County, which just recently has started one. And so that's over half of the counties in the state now have a group of people that are coming together that are committed to helping people make the transition home from prison. And I think that's a big difference and a big change. Remember, Maurice, you said change is hard. We are trying to do it one county and one community at a time while also changing the view in the state. So, and that's why we're working, for example, we've worked with the Department of Transportation, PennDOT, to get licenses for people who are returning home. Before they leave, they are eligible now in certain counties. I don't believe it's yet Delaware County, but certain counties, they will automatically get a state issued ID from PennDOT. Now, this has been a program in effect for a couple of years. We worked hard to get that, and we're working hard. Now it's up to county commissioners to actually support that. So we have to work through every county, but we're doing that. And we're trying to provide additional, working with the Pennsylvania Housing Finance Agency, we're trying to provide extra opportunities, working very hard for people to get low-cost housing. And by the way, speaking about that, we're doing the Pennsylvania Reentry Council is having a housing roundtable on October 14th, and I will send you the flyer on that. So if anyone here is interested in participating, you can do that. The other thing is we've reached out to the County Commissioners Association of Pennsylvania. And again, a lot of this is people just don't realize how challenging, and that's not the right word, impossible life is for people returning from prison. They don't realize the multiple overlapping, interrelated barriers that prevent people from succeeding. It's a systemic issue. It is. I mean, I get it. But how do you change that? Well, you have to teach people, or at least make people aware that there are these issues. So I have spoken, along with others working closely with me, to the County Commissioners Association of Pennsylvania. They're having a conference on October 21st for county commissioners around Pennsylvania, and we're doing reentry simulations so that people can get a sense, of really how challenging returning home is. And also, we're doing the whole thing is about reentry. So here you got the County Commissioners Association, which is commissioners who are leading counties all across Pennsylvania, urban, rural, suburban. They're focused on reentry. And so change is hard, but change is happening.
I can definitely appreciate that. I have some follow-up questions for you, but I want to get Jamila and Jean-Pierre in. I can't hear you, Jean-Pierre.
Could you repeat the question again?
I forgot. It was because I was listening to Rob.
Right, I was listening to him too. So
what else can we do to make it a more, I would guess, open environment for individuals that are returning home from prison?
I mean, all the things that Rob stated, right, as well as when you come home from jail, if you don't have a family, right, you're on your own, right? If you don't have that support group, you're on your own. You're already looked at as a felon. You're already looked at as a castaway, right? A lot of us don't know that Pennsylvania is a state where we can still vote, right? Just knowing these things, it plays a part. So, like you said, that reentry room at the state level, that should happen about 90 days before you come home, right? And you should know where you're going, what you're doing, what you plan on doing, jobs that you can apply for, people that are able to reach out and give you these things. These are the things that
I think that's too late. I think 90 days is too late.
Well, not 90 days gives you an opportunity, right? To if you do it any further, you have people that are in other programs to come home, right? And they put you in those programs for those reasons, right? And they hold it up until 90 days. I had 90 days to get myself together, right? To write home, to get my wife to get the home plan and everything together. So I'm just giving you and if you think 90 days is too late, then 180 days, that's 6 months, right? But that's 6 months out. If I apply for a job 6 months out and I don't come home, somebody's going to fill that. So I think just 90 days just gives you that little faster window. But doing those things, talking to people in the community, right? A reentry council here in the city of Chester, right, is imperative, right? When they come home, they go talk to those people. They give them things. They give them the housing voucher, right? If we have houses in these areas that are condemned, well, they come home and they work on those houses with other inmates, right? It's reentry work. You have to work to eat. And at the end of the day, if you don't work, you don't eat. So if you're not willing to work, again, you don't eat. So, doing these things and building up, and it helps build up a community. It helps save a community, right? And now you feel like you're a part of a community, right? And you can put the past behind you, so to say, right? Currently, I'm working on getting my pardon, right? To put my past behind me, right? Because I feel like it's there, and people look at me, and that's the first thing they see and they hear. All right, oh yeah, he's a felon. He went to jail, and it's like, no, that's not me currently, right? That's the younger me. He was all about that work, right? This older me, he's about talking to you and understanding why you're looking at me the way you are. So I think for the state to enact these programs and to come home and get your ID, and I don't have to run around and try to find somebody to take me out the pin dot and wait in the line, and it's there at the state. When they give you a state ID, they take that state ID away from you and give you a Pennsylvania ID, right? That's simple. Why can't that happen? So I think those programs that he's talking about are right on the money, right? As well as getting voices from that circle, right? Because there's a lot of people in reentry work that haven't set foot into a prison, right? You're in reentry work, you've been in the prison though, right? So for the people that are in that work and they're saying this is how it should go, you get the mindset of a person that's come home and gone through it 3 or 4 times and like, listen, I needed this.
On the Reentry Council, there is somebody from Philadelphia who works with a program who's on the Reentry Council. Okay. So he is somebody who's returning home. He spent 7 years in the feds. So that voice is heard. So I mean, I can appreciate that because I do know that that voice is heard. Our voices are heard in the council, and that's how the simulations are coming about in having the voices heard. So Jamila, I would ask you the same question. How can, the community that's here, how can it be more open and make it easier for someone who's transitioning back into our society?
No, thank you. Well, first and foremost, I was when I came home, I had the opportunity to work at a great diversionary program called New Directions for Women. And it was for women who were sentenced to incarceration. But instead of sitting in jail, they had the opportunity to come to this program. And me as a peer mentor, I met them, and when they first entered for 30 days, they were on blackout. We started to have groups. We started to develop career plans. We started to develop if they needed their certificates, their documents, their IDs, if they needed to get stamps put on, if they needed to apply for SSI, if they needed to get their GED. This is while they were serving their sentence. So instead of just sitting in incapacitation and not doing nothing, this program was allowing those who got sentenced to start working on the things that they were going to need in reentry so that they had a successfully could go into reentry. Like, I got an updated ID, I had my birth certificate, I got this already rolling, I have a place to go to, instead of just sitting in jail and just sitting there. So this was very proactive for allowing returning citizens to return and already had, you know, half of this already done. Because a lot of the stuff that you had to do when you come home, they were doing it while they were serving their sentence, so that when they came home, those things were already in place. And it was a great program. And the Incarcerated Women's Working Group, who I'm a member of, we just introduced a diversionary report to advocate for diversionary programs such as those where instead of you just sitting in jail, there's a diversion that helps you successfully return into your community as a productive member of society. Because otherwise, you're coming home to nothing. You don't have a home plan. Some people, as someone just put in the chat, they can't even come home because they don't have a home plan. So they've served their time, but because they have nowhere to go, they can't even leave. And that's a concern. There should be places where people can go to when they have nowhere to go. And then not only that, like I said, having those diversionary programs, having more programs like that, I believe would be a great solution to that problem in reentry. Having that rolling while they're serving their time. Because those who come from programs come home, they have, you know, they're more successful than those who just sat in jail and did nothing.
Speaking about the homeless population, there was a question, and it was directed to you, Rob, that the committee has learned that homeless people, upon completing their sentence, can be and are being held in prison because they are homeless. What is and can the Reentry Council do about that? And then also, what county is that commissioner simulation being held?
Well, I wish I had an easy answer for that. I think number one, you know, I understand there needs to be a home plan. It depends. If they've completed their sentence, it would be illegal to hold them. And there needs to be, and this is work that we are working on, which is why we're having a housing roundtable. I can't pretend that we have all these issues resolved. This is a massive issue, and it's a critical issue for the health and well-being of any human being to not have a home. So, there is just insufficient number of low-cost housing, and you know, people who just don't have families, as I think Jamila said, you know, it puts them in a horrible bind because they have to live on couches of friends or they move around. So we need to come up with a system where people can be placed and immediately, so that they don't have to spend a day longer than they need to.
And I think to follow up from that, Jim had asked, can or does the reentry process include support to develop that support network before they leave? And I think before COVID, there were many opportunities for that. But since the pandemic began, the programming where individuals were able to go in and to volunteer and to build those programmings have ceased because of the breakouts that are happening inside of the prison. And so how do we get back to that? I really don't have the answer for that, Jim, but I think with some advocacy, maybe from this group, from the League of Women Voters, in combination with the DOC, see how we can get those programs moving again. Because as Jamila mentioned, there are diversion programs, and some of the volunteer programs inside of the jails are more diversionary than individuals just sitting around and waiting. And that's actually how TC began. TC began back in the early 80s. It was a volunteer program. It was volunteers that came in, and then the DOC saw a need for and adapted that program. So, you know, we do see that diversion programs work, and that there are opportunities there, and building the relationship before people leave. Maybe this group, we can start a pen pal group, a very, very simple, sending notes and letting people know that they have support when they come home, and sending them some support services. Kathleen asked, how do we educate the public that reentry education and hiring returning citizens help to stop recidivism? Could this video possibly be put on PBS or something similar? So I don't know the answer to that question, but I do, I am a strong believer that hiring individuals, educating individuals, absolutely puts them on a path to not return to prison. I'm a strong advocate of that. That's how the inception of PAR started, by knowing and seeing this need and no one jumping in to fulfill this need. What other things can students or those interested in volunteering do to get involved with reentry efforts? Can there be reentry simulation for groups like this? Pardon coaching. Where's the most need and what capacity would be needed to be eligible? John Pierre, you want to attest to maybe Chester and your area where you are, and maybe some efforts that are going on there?
Yes. So Jonathan Abdul Rahim King has been offering a pardon clinic for the past, I want to say this is his second one. He's supposed to be doing another one in January. Here at the radio station, we promote that, and we'll be going live from that event as well. Reentry simulations. I've never been a part of that, right? I've never seen that take place, but that would be something, to that way the community can know how it feels to come home, right? You want people to know how you feel when you come home. So I think that'd be a good situation. Where's the most need and what capacity would they be eligible? So like I said, at the end of the day, it's all about what you said this when you first started, is take a deep breath, 10 seconds, and think about the worst thing, and think about how you feel about the worst thing that you've ever done. And if people just genuinely say, I've messed up, he's messed up, let's help him, instead of saying he's a felon and just write him off, I think that will help out the reentry in this county, in this country, right? So much. Because when you come home and people, they look down on you, you just run back to what you were doing already, right? What you were used to doing. I'm not going to walk into this new room with my head held high because they're looking at me like I'm a felon. So I'm going to keep my head down and I'm going to just go over here to the corner and do what I was doing before, right? And that's what ends up happening. Then they get caught right away, right? I told my cousin, I said, you got a PO, you got the police, and you got jokers out here that don't like you, right? Those are the three things you got to worry about when you come home from jail, right? You didn't have a PO before, so you just had to worry about the police. But that third person, that PO knocking at your door, asking for your urine and walking through your house and showing up at your job and doing little things that gives you a tick. And now you're like, all right, no, I'm not going to work. He's not going to catch me there. I'm running from him completely, right? And people end up going back. So I think trauma therapy or trauma-informed therapy needs to be given to the POs as well as the police officers, right? Because I had a PO and he treated me like I treated him like he was my therapist. I told him about everything that was going on with me, right? Because he was in charge of what was going on. He allowed me to go to Mississippi and work on the oil spill when the oil spill happened in 2010. So, and he was like, nah, you have shown me that you are capable of going away and not getting into any trouble, because I was dead bent on not going back to jail. It didn't matter what I had to do. So, a parole officer, right? I'm sorry, Jim. A parole officer, your PO, and people need to do that, right? If you're dealing with convicts on a daily basis, you need some kind of trauma-informed therapy. You need to be informed on what they're dealing with as well, because you can't help them. You don't give them the necessary tools to help them. You give somebody a brick and they need a hammer, and it just doesn't work.
And what about some biases training? Biases in policing, biases in prosecuting, biases in defending, biases are identifying our own biases. Is there something that the state is doing on that level, Rob, to identify one's own biases that they bring to the job and being able to reckon with them?
So yes, at the same time that there's going to be trauma-informed training for police, there's also implicit bias training for police. and that's going to be for all police officers in Pennsylvania. I know that some of that, so again, you can imagine, I suspect everyone on this Zoom has had trainings. You know, you can, if you have too many trainings at the same time and you really want people to get it, you can't do it all at the same time, and you have to do repetitive or you have to do continued. It can't be a one-shot deal so people check off the box. Okay, I've had my implicit bias training. Okay, I've had my trauma-informed training. Okay, I've had my diversity and equity training. We are talking about changing a culture in our country, in our state, in our communities that has lasted for 400 years. So, you know, the bottom line is this is not going to change in a day, although we are beginning. And I get it, there's an urgency of now. However, the reality is how quickly can people change and how much can people absorb? I know myself that I now give lots of presentations on trauma. Every time I hear somebody else give a presentation on trauma, I learn something and I grow from it. And it causes me to want to reach out and learn more. I was just on, Bucks Monco is doing this whole thing on, you know, cultural awareness and race. And I was on that this morning. You know, the bottom line is there's not, it can't be a one-shot deal. It has to be an ongoing culture shift where this is part of the conversation, part of the dialogue, and this is going to go on for years and forever.
So I want to open it up.
I'm sorry. I wanted to say
go ahead,
something
Jamila.
too.
Go ahead.
What they were saying about the just staying involved, and then the culture shift. There's something so small like stigmatizing language. The language changes all the time. So we went from convicted felons to ex-offenders to returning citizens to people impacted by the criminal justice system. And it's not so much why you have to stay involved. There's power in words. It's been evidence-based that what you call people. So if you say, well, you're just an ex-felon, you're just an ex-felon, you're just a convicted felon, then you start to wear that title because people are treating you as such, they're calling you as such, and they're not allowing you to grow and be nothing else. So then you become that label. Or if they say, okay, well, you're an addict, we say persons in recovery. Say, well, you're just an addict. Well, you're just an addict. Well, you're just an addict. Okay, society is treating me as such. They're calling me as such. So then I'm just going to just conform to that. Now, so it's so important to stay involved with trauma prevention care because the language, something so minute as the language. They always trying to figure out ways. This is one of the things, one of my mentors said was the first certified peer specialist. He was the reason why the certified peer specialist program was started. And it's the reason why it's now a Medicaid. This is the victory of the growth of this career, the Medicaid billable career. First thing he said to me in the elevator is watch the language. It's so important to make sure we use trauma prevention and empowering language to people. Do not call them what happened to them because it actually affects their thinking and how they behave and how society treats us. So that's very important.
Rob, another question came for you. It said, don't we also have to look at the kind of people being hired to be police to screen for the biases to start with?
Yeah, the answer is yes. And the other thing is, so, and I think it may have been Jean-Pierre said, absolutely the training, so the whole thing about, we need to make sure that the people we're hiring, have, you know, we can, and there's a lot of background checks, especially in the law enforcement community or criminal justice, where people will look at your Facebook and stuff like that and see the insanity that some people put on it. You know, if you're a neo-Nazi, I don't think you should be hired. Let's try to be as nice as possible. And you know, if you entered the Capitol on January 6th, I don't think so. So the bottom line is that we need to know, and there are tests or exams and things like that to find out, you know who people are, really to lay it out so that people are not hired when, you know, they're tending towards the Gestapo. So I think that that goes without saying. But I think that one of the things we also need to examine for everyone in the criminal justice world, and that's, you know, police, corrections, probation, and parole, is their own trauma. You know, the reality is there's a study that was done in Buffalo that showed that, and I don't know if any of you know about the ACEs study, but I'm going to assume that many of you do. You know, there was a study in the late 90s where it said, you know, if you had certain adverse childhood adversities, you know, it would impact your long-term mental and physical health. Anyway, they showed that if you had 4 or more, you know, lots of bad things were going to happen physically and emotionally. Well, they found out that in looking at Buffalo police officers, 400 of them, their exposure to adverse childhood experiences was higher for police officers in Buffalo than they were for the general population. So that's pretty interesting and scary. So the bottom line is, if we have people who are serving us and supposedly in a position to be able to help other people, and they are going to be triggered by the trauma that they're seeing all the time, that's not a good mix unless they're treated and supported and helped and they recover. So the bottom line is that a lot of that has to happen. I'm not sure if I answered any of the questions, but I just
Oh, you're an attorney, so it's okay. Yeah, this is what you do very well. I do have a question as far as like a earlier question. How can we get reentry offices in every county jail, state jail, and federal jail versus like a package in a room that you can access when you're 90 days out?
I would just add to that question, how could we, because there's a lot of prisons that do have, I mean, with all due respect, there are a lot of prisons that do now have reentry coordinators. The question is, how do you have reentry offices where you have, first of all, you should have a reentry office, and it should be a robust part of the prison environment, because supposedly reentry starts the day you walk in the door. So how can you not, you know, focus on reentry? But the bottom line is the people who are doing the work need to be trauma informed. They need to be schooled in implicit bias, schooled in diversity and equity, and they need to and they just can't be thrown in there without really having some experience on how to deal with people and understanding really the adversity that almost everybody they're going to be working with, including the prison guards or the prison officials, have gone through. So the bottom line is we have to make sure that our offices really know what they're doing. They have to be connected to the outside world. So you can't just have this little reentry cocoon in a prison saying, okay, you can come and we can give you this pamphlet. That's what you're saying. We have to, if you've got a reentry coalition, for example, in your prison in Delaware County, that has to be connected directly to your reentry coalition, and the reentry coalition has to have connections with all the reentry services. So there's a direct pipeline between the reentry services and the prison, so that, and there should be a way for people to go online, and I'm not sure how that works, you know, with prison stuff, but the bottom line is where people can access information within the prison to find out the reentry services. And having said that, there's going to be a Pennsylvania Reentry Council website coming up. It's taken entirely too long, but it is going to have a lot of information, and you know, stay tuned, and you know, I will let you know when that happens.
Rob, do you ever think there's an opportunity? Sorry, Jamila. Do you ever think there's an opportunity for individuals that are previously incarcerated to be on the staff at the DOC, or individuals that have been adjudicated before to become police officers, where, you know, the people, I mean, just having that duality in that sense?
Well, Brandon Flood is formally convicted, and he's the Secretary of Pardons.
Exactly.
What's that?
I said exactly. So,
yeah. So the bottom line is that, and I know the Chief Judge of the Third Circuit Court of Appeals, Ted McKee, hired a reentrant out of Federal Reentry Court. So
he's on my board, by the way.
Oh, and he's going to be working with me. We're having our court's trauma-informed meeting tomorrow. So there you go. He's a great guy. So, Judge, sir, yes, whatever. So anyway, yes, I think that things are changing, and but it's, again, there are certain, you know, if you're going to a police department, you know, they're going to know your record, and it depends on, you know, how, I mean, I do think that there's practical questions of, you know, if you were suffering, if, you know, when was your conviction? How long are you done with probation and parole? How are you doing? And, you know, I mean, I do think there's possibilities going forward. And I do think that, you know, in terms of victim services, it seems to me that's an easy fit for people who have been, you know, returned. So I don't see why that can't happen down the line. I think the Philadelphia DA's office has hired reentrants.
Jamila, you were going to say something.
Yeah, y'all keep having so many good questions. I was going to go back just very quickly to when we were talking about people with home plans and coming home and connecting it with trauma prevention care. I can only speak from, you know, what I've witnessed. There's a very excellent program that's going on in Chester County. It's called Friends, and they do a lot of work with mental health and stuff. They actually, I saw the process of advocating for more homes and more people getting grants who want to open up homes for people that's like coming out of jail and they need a place to go, and it needs to be a trauma, you know, prevention environment. And this organization was very like no judgment zone, and it was just very cohesive on what they were doing and what they were building. If we could have more opportunities for people, if we don't have a building, there's a lot of people who are interested in opening up homes and having reentry homes that are trauma prevention. I have a couple of peers and colleagues that I work with that are trying to do that. So I don't know whatever it is that they have to do in the city of Philadelphia to make it available for a lot more people to do programs just like that. As such, needs to be implemented. And the final thing I want to say, well, I have agree with that. There's a in Philadelphia. There's what's called other counties. It gets complicated for individuals like myself who were impacted by the criminal justice system, because what I got convicted for was not in Philadelphia, but I am a resident of Philadelphia. So there's no program for people that are in my situation, because if you reside in one place, but your probation or whatever gets transferred to where you live, whatever diversionary programs, reentry programs, whatever opportunities are available, they will not be available to you. So if there was a way where just the state as a whole could say, well, the resources would be available to, you know, the requirements could consider that. Because it's like those resources would never be available to individuals in my position if they were, you know, implemented. So I don't know if it could be a universal way to tie that in, other than, you know, it having to be federal related. It could be state, you know, just where you live. I don't know. I'm always thinking of a way where that could be improvised, but that's a big gap too, because you have a large population of people who wouldn't even be able to have those resources even if they were available, you know, because of, you know, I live here, but it was, you know, something over there somewhere else, and I live here, so I'm not eligible for anything as far as reentry resources. Thank you.
So maybe a bridge between the counties, a reentry bridge between the counties and to working there could help. Somebody dropped in the chat, it's not a crime to be homeless, and people are being held in prison for being homeless. How do we stop this? Rob, can you attest to that? Can you talk about that?
Yeah, well, I think we mentioned that before. I mean, you can't be kept in, I mean, if you've maxed out in your sentence, it's illegal, it's unconstitutional for you to be held a day beyond your sentence. It seems to me it's equally unfair for you to be held beyond the time that, you know, anybody else would serve. So there's an equal protection argument on that. Having said that, there are practical issues of if you're releasing person on parole and there is no fixed address, what do you do? it's both for the safety of, this individual and others. So the question is, what do we do? And I'm not sure if the short-term answer is a halfway house. I don't know. Again, the counties may not have halfway houses, so that may be, just not a practical solution. So the thing is that having somebody say report to a shelter is also not a tenable situation, because they may or may not get into the shelter. They may get into the shelter for one day and not 2 days, and so these are complicated issues. I don't have an easy answer to this. Obviously, our society needs to do a much better job, and this is something that we are focusing on, as I say, through our housing committee, on making sure that as many people as possible have housing. I did send Ralph and I sent an email out about the housing, and Anne, about the housing roundtable, so you can send that around. Again, I'm not saying that this is a solution, but what we're trying to do is reach out to essentially landlords and people, in housing around the state to, really enhance the number of, opportunities for people to find housing and to make it easier. The other thing is we have to work with the federal and state government to make it easier, and we are working with the Pennsylvania Housing Finance Agency to make it easier for people to get in with criminal records. So that's something we're working on as well.
Thank you, Rob. I really appreciate that. Jean-Pierre, did you want to leave any last thoughts as we are rounding third here? Did you want to leave any last thoughts and touch on just some encouragement for people? Maybe this group, some action steps, encouragement for people, this group action steps, and what would you like to see for people that are returning from prison?
I would like to see a safe place for people that are returning home. I would like to see for this group to go out and try to enact the things that you heard, or find out who is doing the work and support them. It's hard for non-violent offenders to come home from 5 years. You think about somebody that didn't hurt anyone, that did 5 to 10 years, 12 to 24 years in jail, and try to come home and get their life back. That's absolutely, crazy. And it's hard, right? If you don't have the proper support. And a lot of us don't have that. We don't have the mom and dad home, or he was locked up and his mom died while he was in there, right? Or his sister got sick. Things happen to people outside as well as inside. So, you come home from jail and you don't know where you're going or what you're doing, and all you know is what you did before, right? To add warmth or money to your pocket. So, to take the attitude that you have today, the empathy of caring, right, about someone else. And also what Maurice said earlier, those 10 seconds of your worst act in your life, right? And you hold that tight enough, you'll be able to help people. You'll be able to see, like, this person needs a little help, right? And he talked about the pen pal, right? Writing to someone that just come home from reentry and is trying to find their way through life. That's important, right? A letter, just a letter saying, if you need me, call me. A number, right? I know a couple people that are hiring, right? That's important for people that are coming home and they don't really have any hope. And hope is important as well, right? Hope is definitely important. So, to give that energy to people is man, it can save a life, right? His children's life, his life, right? Or someone or someone else, right? So I definitely appreciate everyone that's on this live, everyone that's here and able to give good energy, right? Continue to do that, right? I charge everybody with that job to continue to give good energy every day. And thank you.
I appreciate that, Jean-Pierre. Jamila, I asked you the same questions. Last thoughts, some action steps for the group, and what would you like to see for people that are returning?
Thank you. I would like to see returning citizens being treated as returning citizens first and foremost, because we have to deal with the prejudice of you got a record You know, I was one person, you know, and then I got a record, and then I've been treated ever since like someone else. So I know what it's like to be everyone being biased against you, but we have to change the language that we are not what happened to us, you know, and treat us like returning citizens. I would like to see opportunities. I would like for mothers to have opportunities because we have to come home. We have to get our children. We have to build our life back together. We have to pay fines, fees, and restitution. And the only way that's going to be possible is for people like yourself who are fair chance employers who will allow job opportunities to open up for us, housing opportunities to open up for us. We have to fight for housing because a lot of us couldn't get housing. People think we can't get a lot of stuff because we have a record. So how can we do anything if we can't get anything? How can we move forward if we don't have those opportunities? So we need the fair chance hiring. We need the housing. We need the housing opportunities. We need the empathy. We need the ability to really have a second chance. If we're home, treat us. Let's start from a clean slate because otherwise the system sets us up to go right back to jail. Like, what else can you do if there's nothing you can do?
Thank you, Jamila. I really appreciate that so much. Thank you. Rob, same question. Some last thoughts, action steps for the groups, and you know, what would you like to see for people that are returning home?
So first, I would say that thanks for everyone being on this call. I suspect you're here because your hearts are tuned into the hardships of people returning from prison. But this is really a civil and human rights issue. And it's really saying that all people who have been to prison should be treated with dignity and respect and treated equally. And that's critically important. I think that we in this country, I don't think we're any worse than any other country, frankly, but I think we in this country tend to other others, and we dehumanize people who aren't like us, who don't look like us, who don't believe what we believe in, whatever, go on and on. But the bottom line is, and then people who get in the criminal justice system are, you know, othered and further dehumanized. We've got to stop that. I mean, this rehumanization, in my view, is the word I learned last week. I didn't know it was a word. But anyway, I think that should be a big thing, a big effort for everyone on this call, everyone on the Zoom, to really think about how they're treating other people, how they are, you know, their stereotypes, their implicit bias, because we all have them. We're brought in a society that's filled with a zillion implicit biases. So how do you deal with it? How do you move forward? So I think that's got to be the first step. The second is everyone in the world needs to be trauma informed. So just talk to Joan. She'll tell you, and she'll do it for you. She'll do presentations for everyone individually, all 7.8 billion people. Right, Joan? Anyway, and then, but I'll help. I'll bring the coffee and cookies. So the other thing is, then we have to think beyond the education. We have to think, once we rehumanize, once we are trauma informed, once we deal with our implicit bias, we have to think, okay, what next? And then we have to reorganize our society to be a prevention society rather than an incarceration society. We only had a couple of 100,000 in 1970. You know, what happened? Well, the war on drugs. So we don't need to do that. It's absurd. It's ridiculous. It's a waste of money. But more than that, it's a waste of humanity. And so, I mean, I could speak for, again, another 6 years on this very subject, but those are my preliminary thoughts.
I really appreciate you guys being a part of this panel and everybody tuning in and being extremely attentive as we talk about these issues that affect everyone collectively from what I believe. I believe that everyone that has breath has that opportunity to change. Just as we mentioned, holding the worst thing you've ever done, holding that, you had an opportunity to change that. And I believe the same is for those that are returning home from prison. People that want to change will, but they have to be given the opportunity to do so. I believe that dignity, humanity, and respect needs to go back into the care of people. And that's how we're going to do it. what I heard Rob say that the state is doing is extremely encouraging. But that's on a really, really high level, and it will trickle down. But I think this group has an opportunity to do some real work in its community. I want to say that one of the things that we don't talk about, we need to talk about. We need to talk about race. We need to talk about the uniqueness of other peoples. And this group has sons and daughters who has sons and daughters, and that needs to be talked about in our alone times when we're talking to our families. Let's talk about it. Let's not ignore it. Let's not wait until the next tragedy happens, because your sons, your grandsons, and your daughters and your granddaughters, they're the ones that are now going to be putting the vehicles in gear to move change. That's what has to happen. So I say identify it. Let's not sit on these wounds any longer. Let's talk about them. Let's open them up. Let's heal from them. And we can do it collectively together. I believe that's an opportunity that we have. I thank you very much for your time. I think the League of Women, Delaware Women Voters, thank you for allowing this opportunity to be here and allowing us to share some of these times for ourselves. I'm going to turn it over to Ann. And again, thank you guys so much for allowing me to be a part of this.
Thank you, Maurice, and thank you to the panel. And in a second, I'm going to turn it over to Joan Duval Flynn to talk about all her efforts. She's been a big part of our committee, and I would just like to say that, just as Rob Reed mentioned, every time we do one of these programs, I know I personally learn so much. I keep taking notes and keep putting things in the chat. So I really appreciate your insight into this topic. Joan.
Thank you so much. On behalf of the media area NAACP, I want to thank the League for their leadership in this series. It is just so important that you have brought this to the forefront and inform the community about some of these extreme situations. Thank you, Maurice. What a marvelous job you've done. Thank you, Jean-Pierre. And did you not host TIEC on your radio show some months ago with Anita Green? I thought that was you. Okay. Ms. Harris, thank you so much for bringing forward issues, especially for calling out the important idea that women have issues and they are frequently very different from man's. Rob, as always, I consider you my friend, and I am always happy you never say no when you're asked to do something. And you're doing a good work in Hill, PA with the Criminal Justice Task Force. This conversation today sounded to me like I was sitting in the pews of a place of worship, because what we're talking about are spiritual issues here, how we treat our fellow human being. I just think the League has done a marvelous thing in approaching this topic. The League is fearless, and I'm proud to sit on this committee. I just want you to know that the media area branch has two committees that I work with. Well, they have more than two committees, but I work with two. One is called WIN, Women in the NAACP. Our mission is to women and children. And through that committee, we are engaged in an expungement clinic, which will happen in November, and there will be more information on that. And we have a project called Send a Mom Home for Christmas, because there are people in jail simply because they cannot pay their bail. And we want to raise the funds to send some mothers who are there solely because of bail issues home to their children for Christmas. So you'll get more information on that. And finally, it is my obligation as a member of the NAACP to invite you all to join this organization that has a focus on housing, a focus on prison. Those of you who really hold this prison conversation dear and deep, you can join the media area branch if you're between Springfield and Chadsford, Aston and Cheney. That is the jurisdiction of the media area in NAACP. You can join the prison committee and you can take the influence, history, and brand with you when you discuss prison issues. And we're just so pleased that 44 people found this conversation to be important and spent their time here with the league. So with that, I'll turn it back over to Ann. You're muted.
I will have to unmute myself. Thank you, Joan. Really appreciate all of your input into the work of the committee. And speaking of the committee, if there's people still here that would like to join our committee, we would love to have you to be part of the work of the committee. The last link that I'm putting into the chat is a link to our calendar of events. If you go to our website and you look at it, click on events, you'll see the calendar of events that are coming up. Some of them, like this program, we're focused on our homepage. And we have 3 virtual candidate forums coming up this fall. We encourage you, if you're going to be voting in those areas, to please be part of that. We have another important program coming up, another hot topic program coming up on October 8th, and it's dealing with conspiratorial thinking. So there's a lot going on between what the NAACP is doing and what we're doing. So thank you for your support and attendance today.